Yeah, there. Good evening, everybody, and welcome again to this our talk. We like talking. We are very talkative people, so we like talking. Uh, we talk. Actually, we are not very talkative, but we like talking. We talk from a platform called She Chooses to Live, which is, I keep saying it's a platform that wants to give people knowledge, especially matters reproductive health. Matters health in general, but matters reproductive health in specifics, so that people can make right choices about their lives and be able to live all that the Lord meant them to live properly. So we give these talks. We also run clinics, and we will soon start going to do some pap smears, some places, so that people will be helped, especially the people who live in slum areas. She Chooses to Live was actually brought about by seeing what people go about in slums. How we happened to go to some slums at some point, and we saw how very unable to access health and to access knowledge that people are in those areas. And we thought we would want to start somehow accessing them in some ways, and especially matters to do with things that can be prevented, sexually transmitted diseases, cancer, such things. And we thought we could do that. And I know that I'm still not getting that audience, because you people that I talk with here are not that lot. You are still what is called, I call Princess Diana, which is the people who can access internet, who can access Nairobi Hospital. Those are who you are, most of you, and which is okay, because it's also we also need knowledge, but we want to target people who really are not able. So if any of you have ideas of how we can help those women, especially where pap smears are concerned, where examinations are concerned, those of you with a say somewhere, you can help us to help those women in the slums to do pap smears, and such things. So now I've talked for the Wajiko. Now let me go back to Princess Diana, and we talk about twins. But even Wajikos get twins, by the way. It's just that uh, they'll not most of the time get to be able to access this knowledge, and they'll not be able to access the facilities that we would all want to go to. But sometimes life is like that. So we do the very best we can for the ones we can help. So I'm called Dr. Jane Wakahe. I'm a gynecologist by profession. I've also studied what is called public health, and that was in an effort to know Ajiko, because like I'd worked with Princess Diana forever and ever, and I wanted to know how Wajiko lives, and I found Wajiko lives not very comfortably. So I have a tech guy here. She's called Marion Wakahe. She helps me to talk to you guys. She puts me on online and keeps me there. That is her main job. But now let's talk about twin pregnancy, which is what we are going to talk about today. It's again a biggish topic, so I'll not do it in one go. I'll do it in two sessions, this today and next Friday. So today we'll do a few things about twin pregnancy. Then next Friday we shall continue with the same, and we will hopefully finish. I expect a lot of questions about this topic, because it's a very interesting topic. A lot of people have asked for us to talk about it. So here goes. What is twin pregnancy? Actually, the proper definition is multiple pregnancy, because it may be not just two. Twin means two. but it could be 3 or 4, sometimes as many as 5. So we are talking about multiple pregnancy. And what is the definition of multiple pregnancy? Is that one uterus is carrying more than one fetus. Normally, the usual times a uterus carries one fetus, one baby. But in multiple pregnancy, they are carrying either 2 or more. Now, this is not a very common happening, twin pregnancy in nature. If you talk about twin pregnancy, it will happen only once in every 250 pregnancies. That is a twin. And triplets, natural triplets are very rare. I know these days we have more twins and more triplets because of what we are going to discuss about IVF and fertility. But if you leave it in nature, then you will find that the twin pregnancy, only happens one in every 250 people pregnancies, and the other multiple even much, much less. Now, what happens to make it twins? There are 2 ways. One, normally a woman produces one egg every month, one what is called an ovum, and that ovum is matured and presented for fertilization, and it gets fertilized and it makes a baby. Now, there are times when a woman can produce more than one egg or more than one ova, and they are both more than one of them, and they are both fertilized at the same time, and so they are hosted in the same uterus. And like I said, this is quite rare. It happens once in every 250 pregnancies. So that's how come they can get twins, which is called fraternal twins in that case. So so it can be either 2 eggs or 3 eggs were fertilized and made 2 or 3 babies, or it can be that one egg was fertilized and it divided and it made 2 babies. So there are 2 types of twins. We're going to discuss twins mainly because triplets are very rare. In fact, so rare that in my almost 40 years of practice, I've only delivered 3 sets of triplets. Twins I've had many, but triplets I only have 3 sets to show for my 40 years of work. So they are very rare lot. So what is the 2 types of twins? The first one is called fraternal twin, and this is where a woman produces 2 eggs, and the 2 eggs are fertilized by 2 different sperms. So these are 2 people who are totally different. They are just, it's just that they are sharing the uterus, but they are totally different. 2 sperms, 2 eggs. And these ones will usually be they will not look alike. They will just look like brother and sister or sister and sister. And they may even be the 2 different gender. They could be a boy and a girl, or they could be 2 girls, but not looking alike. Then there is the set that is called identical twin, and this is where the woman produces 1 egg, and the egg is fertilized by 1 sperm. And in the process of the egg dividing itself to make itself into a human being, it can divide into 2 early. It divides into 2 and then actually makes 2 babies. And these babies are totally identical. They have the same kind of genes. They are totally identical. They are always the same sex. If they are identical, they look alike. They are the same. Totally the same, and they will always be the same sex. Now, who gets to have twins? Now we are talking natural. I'm not. I know there is the fertility and in vitro fertilization, which is a different issue altogether. But in nature, who gets twins? Now, twins run in families, so that if your family has got twins, and now we are talking fraternal twins. Fraternal twins run in families. If your family has got twins, and especially if your mother's side has got twins, so that when it is the maternal side who has twins, then the twin chance drops from the natural 250 and goes as high as 1 in 60. So from 250 to 1 to 60, that's quite a jump. So if it is the father's side that has twins, then the odds are 1 in 125. So the mother's side carries more of the strength of the gene of fraternal twins. The identical twins are hardly familiar. Those just happen. It's the fraternal twins who become identical. I mean, who run in families. Now, the other reason why women get twins is the older they are. In fact, you will find twins in women who is at age 30 and above. Uh, and that the reason is at age 30 to 35 there before the fertility starts to go down. And that's when a woman's is possible, it's easier for her to produce many eggs because the hormone that the hormone that tells the eggs to be produced is at its peak in the early 30s. So women who are 30, you'll hardly find twins in the women who are 18, very rare. But women who are 30 and before the fertility fades away, those are the people who tend to get twins, and especially to get whether identical or fraternal twins. Those are the people that are more fraternal because they produce more, they are more easy to produce over that can be fertilized. The other lot that will get twins now, not in a natural way, is those people who have been put on fertility tablets. Fertility tablets sometimes force or stimulate the ovaries to produce more than one egg. And if that happens, then a woman can get more than one baby in their uterus. This is a surprising one also, that actually, did you know the fatter you are, the more likely you are to get twins? Women who have BMI of beyond 30, the obese ones are likely to get twins, and the taller, if they are taller and also fatter, they are likely to get twins. Then of course comes the ones who are what is called in vitro fertilization, which is that the eggs are harvested, then they are fertilized outside the body, and then they are implanted into the woman. This usually where there is a problem with accessing the sperm, accessing the egg, so where tubes are blocked. So normally a fertility expert will harvest the egg, in fact, have it fertilized with the sperm outside the body, and then implant the egg. And for the sake of making sure that at least one baby implants, then the fertility uh, people will tend to implant more than one baby, more than one egg, more than one fertilized egg, so that hopefully it will take. So um, then chances are that it could be two, it could be three, or it could be just one. Some eggs may not take, so it could be just one. Uh, Now, what is what are the signs that tell you that maybe you're carrying twins? We talked about signs of pregnancy a while back, quite a while back. I can't even remember when. But what happens in the twin pregnancy is that those signs get exaggerated, thoroughly exaggerated, so that when the way you feel with when you're carrying one baby is really multiplied by many when you're carrying more than one baby. And what you feel is the very severe tenderness, very sore breast, severe soreness of the breast. You feel that it's really exaggerated. You get a bit more cramping. We said that when one is having implantation happening, when the baby is burrowing into the mother, then there is a bit of cramping. So in twinning, you get even a bit more cramping. It is likely that one will bleed what is called implantation bleeding. It's more likely with twins than with a singleton. One tends to have frequency of urination really very, very much because the uterus is getting quite bigger before, very, very rapidly. So it is sitting on the bladder and making the frequency of urination quite frequent. One may even imagine that they have an infection. They are forever wanting to run to the toilet. Then there is a lot of nausea, very, very marked nausea. And much of the time it gets to where we call it hyperemesis gravidarum, where somebody will need to be admitted and given some fluids because it has become very, very, very much. One tends to get headaches more than in singleton because, again, the headaches of pregnancy are that the people are sharing the fresh glucose that somebody has eaten. And when you're sharing with more than one person, then you tend to get a bit more headaches than usual. Then the other thing is constipation, a lot of constipation indeed, and bloating in the very, very early pregnancy. We get quite a bit of nasal congestion very, very early indeed when it shouldn't, with a singleton, it shouldn't be happening. Then there is mood swings, a lot of mood swings indeed, when one is carrying a singleton. Now, there is something that is called hydatidform mole. It gives these very, very signs. So it is a good thing that now we have technology where we can tell that these are twins and not hydatidform mole, because this is something that will present exactly the way I've said, very, very exaggerated pregnancy symptoms indeed. And how does one confirm that they have twins? One, I know many of us hope we are carrying twins. And when there were no ultrasounds, we used to even swear I'm carrying twins, only to find finally you are carrying one baby. But anyway, now there is confirmation of twins as early as 5 to 6 weeks from the first day of the last period. If one is done an ultrasound, it is possible to see that there is more than one gestational sac. Gestational sac is the first thing that appears before the baby even appears. So it is possible to see that there are two gestational sacs or more in the uterus. And then it's easier to it is good to confirm at week 12, because then sometimes one can miss a twin in early gestation, and sometimes there is something called vanishing twin. In fact, technology comes with a lot of things, some of them good, very good, some of them not very good, because there is a phenomenon called vanishing twin, which means that there were twins at the beginning, and then at some point one twin demised and got absorbed by the body. This before the ultrasounds came, nobody knew. But now one would know that they are carrying twins very, very early indeed. And then lo and behold, at week 12 or 13, there is only one baby. Where did the other one go? And that phenomenon is called vanishing twin, which is not very rare actually. It happens like once in every 20 to 30 twinages, one twin will vanish in that case. So there is technology will tell you you have twins, or you, in fact, twins is easy to tell, but you would have to maybe wait until about week 12, 13 to confirm that they are triplets, because those are harder to tell that they are more than two. So as early as week 6, one can tell that they are having twins, and hence be able to start behaving like they are carrying twins. Now, they always get a bit bigger the uterus gets a bit bigger than when it is carrying one, and one would be forgiven thinking they are much, much older pregnancy than what they are, because the tummy, the bum of the pregnancy becomes much, much bigger before time. Now let's talk about this accommodation that these people share. And there are different ways of sharing this accommodation. They all share one uterus, those more than one babies. But there can be that there are different ways of sharing. The house is the same. There are different ways they will share. They can have, each baby has their own placenta and their own amniotic sac. The amniotic sac is where the baby swims throughout pregnancy. They are forever playing inside. They have a swimming pool. So every baby, it can be that each baby has their own swimming pool and their own placenta. And those will usually be fraternal twins. Or it can be that there are two babies who are sharing one placenta. These are usually identical twins, but the usual is that they will share one placenta, but they'll have their own, each individual will have their own swimming pool, their own amniotic sac. And the third variety is where actually the two people are sharing the same placenta and they are sharing the same swimming pool, amniotic sac. This is very, very rare indeed, which is a good thing because it's a dangerous situation where babies can entangle each other. They're in the same swimming pool, so their cords can entangle each other. Fortunately, it is a rare occurrence. The more common, even when they are identical, is that they are sharing a placenta, but each person has their own swimming pool. Now, let's talk about the diet in twin pregnancy. We talked about diet when we talked about pregnancy. The same rule holds that we will have at least 6 meals in a day, 6 light meals in a day, not very, very heavy, 6 light meals, because the babies need constant sugar supply to be able to build themselves up, to be able to build their organs. And they also need constant protein supply, the building blocks that they need to build themselves with, whether they are one or they are two. Now, when they are two, then one needs a bit more extra. One needs to up their amount of food, all varieties of food. One needs to up their carbohydrate intake because they are now feeding more than one baby. They are feeding two. So one needs to add maybe about 150 calories to 300 calories, which means maybe like not a whole loaf of bread, like 3 slices of bread would be the extra that you would be doing in a twin pregnancy. If it is triplets, then even a little bit more. So the carbohydrate goes a bit more. Now, what must be increased is protein, and whereas in a singleton we recommend that you have at least 3 helpings of protein in a day. When it is a multiple pregnancy, then we expect you to please do 4 helpings in a day. Because these people, everybody needs to make their own body. They need to make their own organs, and the protein becomes a building block. So we need that. Now, the other thing that is absolutely needed is calcium. Sometimes when it's a singleton, we may tell you to you can get away with milk or with a bit of cheese. But when it is multiple pregnancy, then you want to supplement because it's almost impossible to eat for 3 people and give them enough calcium to form their bones, to form their teeth, and to remain with your own teeth. Like I think I must have told you the time I talked about pregnancy, is that we used to be told that you can tell how many children a woman has delivered by the number of teeth she has lost. Because if you do not take care of your calcium intake in pregnancy, you will lose a tooth because the baby has to find calcium somewhere, and they find them from your teeth, and they find it from the your hip joint, so that the baby has to form bone. And well, if you don't give it calcium, then it will steal calcium from you. So it is necessary that you would take calcium. Now, the other thing that one needs to take is iron. We are talking now that we are building blood for 3 people. We are retaining the mother's blood, which ultimately dilutes in pregnancy. It gets diluted, so she needs to make more red cells to make her blood to be able to carry oxygen properly. We are also talking that more than one baby is forming their own blood. So iron is a must. So again, whereas we can tell a Sigoton, somebody who is carrying a single baby to get away with a bit of managu and a bit of terere, in multiple pregnancy, then iron is really a must. Now, the surprising thing that maybe people don't know is that you must take a lot of water. Water is vital. In fact, one of the reasons that people go into premature labor is dehydration. And when you have got more than one baby, you are carrying more than one baby, your chances of going into premature labor are even higher. So you want to keep yourself hydrated so that you do not go into premature labor. So water is very vital indeed. I keep saying water, and I must drink my water now a little bit. But water is actually a vital thing, very vital in every circumstance. The other thing that one needs extra are the vitamins, especially vitamin C and folic acid. Folic acid, we give an extra dose. We will supplement folic acid when somebody is having multiple pregnancy. We will not give the usual 4 milligrams. We may give 5 or 10 in multiple pregnancy. And the more babies they are carrying, the more we will give. Now let's look at exercise that you do when you are carrying multiple pregnancy. And exercise is good. Exercise is always good in general, and is good in pregnancy. But when you are carrying more than one baby, the chances of miscarriage are much higher at whatever stage of pregnancy we are talking about. So the exercises you do when you have multiple pregnancy is something very light. It has to be very light indeed. It has to be exercise that doesn't exhaust you. Any exercise that involves heavy lifting is out. Any exercise that makes you stand for a long time is out, because that puts pressure onto the pelvis. Anything that makes you sit for too long is out, shouldn't be done. Any exercise that makes you raise your body temperature is out. So there are all kinds of exercises that you must not do. You must not do very aggressive aerobics. You must not jog. You must not run when you are having multiple pregnancy. With a singleton pregnancy, then you can get away with it. But when you are having multiple, then it becomes very hard to sustain that pregnancy if you do high impact exercises. So whereas you are not supposed to be bedridden, you must not be bedridden. It's not good when you're pregnant to be bedridden. It comes with its own problems of sometimes blood clotting. And when you're twinning or tripleting, it's even more likely that you'll have a blood clot. So it is such that you should not be bedridden. That's not the idea. But the idea is to do gentle exercises, and the best exercises would be just walking, strolling around slowly much of the time. and also swimming. And swimming is good at any stage of pregnancy, even if it's a twin pregnancy. And then there's also for the Princess Diana's the water aerobics. That surely is only left to the Princess Diana's of this world, but you can have that. Now, the thing is, if any exercise makes you start to feel abdominal pain or to feel abdominal hardening, when you put your hand on your tummy, it becomes hard. Or if it gives you a period like cramp or gives you a backache, anything that or makes you feel exhausted, any kind of exercise that will do that for you, even if it is just walking, take a break and rest. I think we'll stop there today with at the place of exercises. I hope I've covered quite a bit for today. We will continue next week. Next week we shall talk about the complications of twin pregnancy, what you are to expect as you carry the pregnancy. We will talk about the delivery of multiple pregnancy, and we talk about the dangers of both during pregnancy and um, at the time of delivery, and we shall recap how to know whether you are going into premature labor, because most multiple pregnancies are born prematurely, so we want to keep them as long as we can, but we will want to know when you are going into premature labor. So we shall discuss how to follow throughout the pregnancy and the complications we expect with twin pregnancy as compared to the single pregnancy. It's a good thing to have twins, but it's a very difficult something to have twins. It comes with its own kind of complications. So that's it for today. We will stop there. It was a short one today. We'll stop there, and then next time we shall continue with those complications that we were talking about. So, yeah, that's it. Comments. Hi, Jennifer. I can see you there today. Yeah. So I'm seeing no questions for the time being. I can see comments of people tuned in. Thank you so much. Thank you, thank you. Tech guy, we are finished for today. No, there are no comments, but Wamoyo is there. And it is from London. She says, "We've missed you." So I think there are no complaints. There are no.
Yeah, there are no questions.
Yeah. So I think next time it will be more interesting. There will be complications. There will be delivery, and that's where the crux of the matter is. The complications is how to look after yourself, but today we have done eating and diet. I mean exercise. So bye bye everybody. We'll see you.